Welcome, everybody, to the second in the series of webinars that I'm doing. In this one, we're going to focus on looking after the siblings, which can be very difficult as well. And a lot of focus does go on the patient, especially initially, but we're going to talk about how we can help and support the emotional needs of the siblings as well. So if you haven't met me before, my name is Debbie Cullinane and I am a child and adolescent psychotherapist who specialises in play. So I have worked with lots of families who have been affected by childhood cancer, and have been doing the parent workshops with childhood cancer now for a couple of years. And they have been excellent and have taught me a lot about how this journey is for families. It's really difficult, but we have learned so much from the families who have attended the parent days and have found them just fantastic. And I used to work with a little boy for a few years who had ALL, so I did get a first-hand experience of the steroids and the treatment and all that goes with it, and the impact that it had. The little boy that I worked with, he was the youngest of five boys, and it's funny, it affected all of them in a very different way. And sometimes you see the impact much later after the treatment has passed as well. So it's always good to just reflect on that if you are attending and your child is out of treatment for quite some time and the sibling is still struggling. It can take a while for it to impact us, depending on how your siblings have internalized what has happened in their little world. So the aim of this webinar from Childhood Cancer Ireland is just try to help and provide practical tools and support to help you and your family, the patient and the siblings, to navigate this very difficult journey. And when your child does have a childhood cancer diagnosis, it's very lonely, it can be so shocking, and it can be really hard for you to manage and to navigate. So we are always here to support you. So please reach out at any time to avail the supports with Childhood Cancer Ireland. And I'll talk a little bit more about what they have in place as well for the siblings. I always start webinars and everything I do with this third rule of secure attachment for Dr. Ed Tronick, because it really just gives us a bit of peace of mind as parents that we don't have to be getting it right anytime. But when you're going through this very difficult time, you don't have to be getting it right either. So this tells us that if we can attune to the patient or the sibling about 33% of the time where possible, then that's enough for them to still feel safe and securely attached to us. Then we rupture a third of the time where we don't get it right and we do the wrong thing and we say the wrong thing, and that's all right too, because we're all human. And then the important part is that we repair. So when we get the opportunity, we can repair those ruptures, come back and say we're sorry, come back and have some special time, some one-on-one time with them when we can. And then they will be still securely attached and feel safe to us. So give yourself a break if you're finding this hard. We just need to get it right around 30% of the time. And sometimes even that can feel like too much, of course, when you're going through this journey, especially when you are at that initial stage, or if you're spending a lot of time in the hospital with the patient themselves. So when you're talking to your child, depending on what age they are, they could be a child or they could be an adolescent, about their siblings' diagnosis, it's important to be honest as you can be. Um, my granny always says the walls have ears when there's children around, and it's true, because they will hear you speak on the phone, they will read messages on your phone, they will hear and see and sense what is going on. So it is important to have honest, age-appropriate conversations. This is really key, because we don't want to hide information, because when we hide information, then that can actually heighten the anxiety and can cause fear and mistrust, and they might think that you're lying to them, and then they mightn't believe you when you're not lying to them. So it is important to just try to be as honest as you can be. And it's very difficult for you to even do that as well, to talk about your other child in that way to their siblings, but it's much appreciated by the siblings when you can be honest. For younger children, simple language is key as well at best. So your brother's body is sick and the doctors are giving him special medicine to make him better. And that is very simple. It's easy to understand. You're not leaving anything to chance there. It's just like, your brother's body is sick. The doctors are giving him special medicine to make him better. And that's what we all believe, and that's what we want to happen. And you can use books and you can use visual aids for younger children. You can use different things. If they're having anxiety, you can use worry books or feelings books. And is there any books actually, Maria, that you'd recommend for siblings? Do you have any that you would have used?
Oh, I can't think offhand now, but I can email a few
Yeah, we
suggestions
must have a
later.
think. There's definitely
Yeah. Oh,
some.
there.
My brain isn't working to think
Yeah.
right now this second, but we
Yeah.
must have a look at, because there's definitely some out there that I have seen.
I
Um,
might go behind the scenes now while you're
oh, that'd be great.
chatting and see if I
You
can
did your research.
pull
That'd
up
be
one.
brilliant. Thank you. Um, then older children might want or need more details, and that's okay too. Allow them to ask the questions and answer as truthfully as you can, while you're trying to balance hope. And that's what all we can do. We can say what we know to be true and reassure them that you are there and you are in this together, and this is going to be a really tricky time. It's okay to name that this is going to be a really tricky time, and that you might be away or you mightn't be around, but you will be on the phone and you will be able to FaceTime and or Skype or Zoom or see them as much as you can, and try to still keep some ritual and routine around that where you can. If you can tag team in a partner at the time when you're in the hospital, where you have a specific time where you do call your children on FaceTime and check in with them, like that can mean the world, and it can be fantastic for them to just have that time where they know that's safe. Okay, I know that mommy is FaceTiming me at this time. If that changes, somebody is going to tell me. And the experience of the trauma itself will be very different for you. It'll be very different for the patient, and it will be very different for the sibling. So you will all experience this through a different lens. And you could have siblings who experience it very, very differently as well, depending on their age, their stage of development, their internalization, how their temperament, how they um, navigate things themselves. So, how it affects them will be very different for all of them. And you might feel like, there's not a bother on them. And then other children might feel more worry or anxiety. They will process the siblings' cancer diagnosis, yeah, differently. And younger children may not fully understand. That's why just to keep the language very simple is best, because they will sense the stress, and they might have different behaviors as a result. And normally the behaviors, especially for younger children, are because they miss you and their world has become a little bit more unsafe because everything was okay and normal. And the next thing, we always say in the parent workshops, it's like a tornado goes through your home and everything changes in a flash. And that's the tricky part often for the siblings, is that they miss you. They feel unsafe. They feel like anything could happen at any minute because it was just like a bam and everything changed. So they might be clingy, they might regress in different things, you might be seeing more tantrums, and that's okay because they're just trying to process what's going on as well. And school age children or adolescents, they might feel confused, afraid. Uh, Left out is a big one for siblings, that they feel like, oh, look at the patient's getting all the attention and I'm not getting any. That's the way it has to be for that time, but they can feel they can feel hard done by. They can feel overlooked, and sometimes they can even feel guilty or feel responsible, depending on what has happened prior to the patient's diagnosis. They might be like, oh, was it something I did? Like, did I cause this? And like, that's really hard to feel like that. So trying to be open to all of those conversations is so important. They might have anger, you might have differences in their behavior, struggles with school, anxiety, or you might notice them being increasingly independent. It's like, I can do this, I've got this, I can do this without you, I don't need you, you go and mind them. Or resentment as well, because you're gone, and resentment towards the patient too, because they're getting all the attention and they might be jealous of that. And that's all right, I think, to feel like that, because the patient does get all the attention. And every time you will pick up the phone to somebody or talk to somebody, it will be all about the patient. Just, how's John? How's John doing? Is John okay? And when people visit and the patient is home, they would go straight to John. It's like when a new baby comes, the siblings get overlooked and it's like, oh, let's go and make sure that this person is okay. And it'll be all, I hope you're minding your brother. I hope you're being good. I hope that you're doing this. And they feel like, oh, really? Is this my role now? Is this what I have to do? I'm now no longer me. So my sense of self is gone. Now I'm John's sister. I am the cancer patient's sister. So actually their name comes before mine. And it'll be talked about at school and it'll be talked about everywhere. And it's really hard because you don't want to define yourself as somebody's sister or brother. You're you. And you deserve to be you, and you deserve to be authentic in yourself and have a good sense of self as well. So jealousy is a really big one that can come up, and a hard one, I think, for us as parents to manage, because we're like, Jesus, you can't be being jealous over your poor brother or sister having to go through all of this. But actually, they absolutely can be. And I remember at one family we were working with, it was at one of the parent workshops, and I think I had a parent consultation after, and it was siblings, two girls, and the older girl was the patient, and the younger little one was the sibling. And she turned around to them one day and she said, I can't wait to get leukemia. I can't wait till it's my turn, because the bigger sister was getting everything she wanted and all the attention and squishmallows and TY teddies, and it looked like this was the best thing ever to get leukemia and get all the attention. So they can be very skewed understanding of what's going on, because they're not present for the procedural distress and all that goes on when you're in Crumlin and all the difficult times. They just see, wow, they're getting all the attention. This is class. So being open for all of these tricky conversations is key, really. So reassuring them when we're supporting their emotional needs, that they are loved as well and important, and that they are themselves and they're not John's sister. They are themselves, validating their feelings. It must be really hard to have a sister who has cancer. And you don't even have to say any more than that. We just hold the space after that and see what happens. Because we often don't hold space, we often overtalk. We'll be over talking. But they just want the space and they want to hear, yeah, it is really hard. I totally get it. And breathe. And it's hard for you as well. And it's hard to even say that. Keep encouraging the open communication and the age appropriate conversations and letting them ask all of the questions. When you are available to them, provide some sort of sense of control. So their control will be gone as a result of this, and they'll feel a bit powerless. So we want to provide little bits of control where we can. So letting them choose different things, even if you have a support system and they might be staying with granny or with their auntie, that they would decide where they would want to go, or that they would decide different things, when you can give them little choices. So we're giving them little notions of control where possible. And when you're in the hospital or at that time, trying to keep the routine for them as consistent as possible, because that's going to really help them to just maintain a sense of normalcy while you're not around. Obviously, they will miss you. If you are parenting in partnerships with there's two of you, that like you can tag team in and out is great as well, even for yourself. Because sometimes as the mother or the father, you feel like you need to be the one there all of the time. But if you can tag team in and out, that's great. So then you can get home to see the siblings for a small amount of time, and then go back in and try to involve their other safe people if you have them is great. So extended family and friends, and encouraging lots of positive interactions with other people and lots of attention on them as well for being them. And not asking lots of questions about the patient and how the patient is and are they being good for mommy and daddy and are they not causing any bother. Just letting them be themselves and stay in their consistent routine can be really helpful. When you do have a chance to get home to them, one-on-one time, like and I'm talking about 5 minutes, 5 minutes, 10 minutes, whatever you have, short little bursts of connection will be so powerful to build up their little systems and their connection cups and their love cups. So little bits of special time, even if it's only that you only have the few minutes, if you can get it, even if you have a few different children at home, if you can get even 5 minutes each, that can be so useful and so helpful to try and fill them up from the inside out. And sometimes, depending on the child's personality or temperament, some children might be great at if you give them a role. And it can be a role to do with the patient, because sometimes they will want that. If they're great, like little organizers, so they could be like the helper who helps with the bits and pieces for the hospital and helps to like look after the patient as well. Some children thrive on that. They love to be involved in that sense, and they feel like, they're really useful and they're helping and they love that. Or it could be that they have a little role that they're deciding on the fun things that you do when you're, at that maintenance stage, or you're out of the hospital and coming out of the treatment, that they're like the chief fun officer, and they're going to decide the different things that you do. So you're giving them another role for themselves. And modeling emotions as well is really important for you. Don't think that you need to pretend that you're fine. You don't. You don't have to put on a show for the sibling all the time. Of course, we try and hold it together as much as possible and try to be there and to be present, because we know that emotions are contagious and our nervous systems are attached to each other. But there will be days and there will be times when you're not. Okay. And it's okay to say to the siblings, I'm having a tough day today. Like, this has been a really tricky time, actually. And I thought it's hard, because they're finding it hard too. And you don't have to lie to them as such and pretend that everything is fine, because sometimes it's not. And if you can show them that it's okay to be sad and scared, and you can also show them that it's okay to be hopeful, because we are. But you can narrate your emotions sometimes. It's absolutely fine to do that. You don't need to take on this protector role where you need to stand strong, because they'll sense it off you anyway. So if you are upset, they'll see that you've been crying, and you can say, yeah, I actually was crying because I actually finding this a bit hard, because I'm worried and I'm sad and I don't really know what to do. And then you can model, do you know what I'm going to do to kind of make myself feel a bit better? I'm going to have a drink, I'm going to get some chocolate, and I'm going to wiggle about. So we're modeling self-care for them, and that'll be different depending on their age. And I know that the self-care webinar with Mairead is going to be absolutely brilliant. So you definitely want to tune into. And when you're thinking about minding yourself, when we can mind ourselves well, then the children will feel that from us. So it's really good. If there is, if you're concerned or worried about one of the siblings, or if they're withdrawn, or you feel like they have a lot of sadness to a worrying extent, or there's huge behavior changes, or they're having trouble with peers or at school, or they're expressing feelings of guilt or hopelessness, they may need extra support. They might need play therapy or creative psychotherapy or counseling or something like that, something further. So reach out to Childhood Cancer Ireland, and they can signpost you to the services that are available, both with Childhood Cancer Ireland and elsewhere, depending on if your child is, young, middle stage, or an adolescent. There's lots of supports out there, so don't be afraid to seek them out for your family, because they want, everyone wants to help with this. This is a get through time. This is an important thing to note. So things might go all over the place for a while, and that's okay. So don't be worrying about If they're having too much screens, sure, they'd probably love and adore it. Or if people are buying them presents and they're getting treats and all that, that's all right. Because everyone is just trying to make the siblings feel special and safe and warm and loved and better and distracted. And distractions can be very welcome at this time, because it's so tricky. So whilst we're trying to maintain some normalcy, it's also okay if people are distracting them with bringing them off to do things, to go places and all of that. That's absolutely fine. Try to keep holding your boundaries where you can. So we'll still, acknowledge all of the feelings. We will still clearly set our limits as to what is okay and not okay. And if they're still struggling, then, we can target alternatives for their behavior, but we want to still hold some firm boundaries as much as possible. Don't think that you need to just let all the balls fall and just let them do whatever, because you don't. It's okay. And actually, boundaries are safe. So when they're pushing them, they're trying to say, will you still keep me safe at this stage? Am I still important enough to be kept safe? So try to still hold your boundaries. But your parenting values might change for a time, especially at initial diagnosis, because you're just upended. And during the treatment stage, it can be tricky too. So don't worry about that. They can always be re-established at a later date, and this will be baby little steps. And if their behavior is all over the shop, don't stress about that either, because this is the get through time, and they're just trying to process it, and they will all process it in different ways. And if your child is very devoid of of emotion about their siblings' cancer diagnosis, that's also fine. They don't have to feel a certain way about it. They don't have to feel sorry. They don't have to feel sad. They don't have to feel any of these things. Um, and some of them might be, feeling absolutely fine for times. And that's great. That's perfect. That's the way their little systems are processing it for now. And you might see changes at a different stage. So it's all very dependent on what your child is like and how they view the world and how they view this time. And that's okay. We stay open to whatever way they are. They can be whatever way they want to be about their sibling having cancer. Um, but don't be stressing if they're behaving badly as a result of the big change. Things will get better with time. And that can feel like a very big thing. Added in with all the other things of you trying to process getting through the cancer treatment for the patient themselves. So just to kind of wrap this up, and I'm sure Mairead will have some things to say as well. You're doing your best in an extremely difficult situation, so go gently with yourself, and try to mind yourself. Listen to Mairead's webinar, definitely, and there's lots of other information about minding yourself in the looking after the patient webinar too. And supporting your children emotionally is so important and can feel very overwhelming when you're facing everything. But like I said, small little gestures can have a big impact on the siblings' lives. So try and have routine times when you call them, as I said, routine times when you face them. Is it that you do it as they're going to bed? Just as much as you can. And there's a bit of research as well, actually, that around the most important times in a child's day to feel safe and seen and soothed and secure and heard and valued. And it's 3 minutes when after they wake up in the morning, the 3 minutes when you unite with them, or that can be on FaceTime or wherever, and then the 3 minutes before they're going to sleep or to bed at nighttime. So if you could even think of those when you're planning, when you're going to speak to them, that can be really helpful, because then they'll be like, okay, I talked to mommy at this time, at this time, at this time. And as much as you can keep that safe and routined, then they will feel really safe and routined, and they'll feed that from you as well. And reach out to Childhood Cancer Ireland if you need it, and reach out to other people for support as well, and try to take care of yourself as well. Now, Right, I'm sure there was plenty of things that sprung to mind there as I was talking.
Thanks, Debbie. I'm after putting a few resources into the chat. I thought I
Great.
put them in earlier and didn't realize that my IT skills are not great, and I was only after sharing with Debbie and not everyone. But anyway, the first one was my brother or sister has cancer. So it is a book, it's a PDF. So hopefully you can get the link there. If not, I can share it with you. The next one is someone in my family has cancer. So it is a YouTube video for children, and it teases through what is cancer, and then it teases through different treatments and looking after themselves and being able to talk about how they're feeling too. And then the next one, the last one, is What is Cancer, which is a YouTube one as well. And there's a whole series on there of what is radiotherapy, what's chemotherapy, about losing my hair. So there's lots of different little ones that are really age appropriate and really targeted at younger little ones. So I suppose what I do recommend is that maybe you look at them yourself, see if they're age appropriate for you and yours, and then maybe it's you either watch it with your little one or you get language that might help you to understand, because it kind of gives you kind of from their perspective, from a young person's perspective, what things are important or what way to talk, what language to use. When you were talking there about even the 3 minutes of connection at bedtime, and which is brilliant. 3 minutes is, it seems manageable most of the time to have connection. But I'm just thinking if you're, sometimes that's not even feasible.
Yeah.
So it's like what I love is the book called The Invisible String,
Mm.
because it's a lovely way to being connected when you're not there in person. Now, there is a read along on YouTube as well, so you don't even have to buy it. But it is a gorgeous one to have at hand, because it looks at how we're connected and different ways we're connected. And it could be a lovely way to have that link if you can't call, if you're in hospital and you can't call for the 3 minutes at night. Maybe you've read the book with your little one, you've learned to use it as a link object, because they can use it in school as well. They're linked to you even though you're not there. And maybe it's someone else then that is reading it at bedtime, so you're still having the link, so you're still having the connection, but in a way that feels feasible at that time.
Yeah, it's a
um
really good book.
it really is. It is. It's a fun book. And as you mentioned earlier around the, just being just talking about how you're feeling yourself. I really miss you when I'm in, when we're in hospital, even though it can't be helped, and it's really hard to be there. So then that's where the book comes in as well, that you can mention, but we're connected. And I think especially younger little ones, it is about naming who's there for them. So it's not to, offer them false reassurance or making a, finishing with a positive after saying I miss you. It's about, just reminding them who is there, because I think especially little ones, it is a survival. Who's going to look after me if mom or dad are not here, so that I'm fed, watered, have routine. So it's like, I really miss you. I wish we weren't in hospital. It's really hard for all of us. And you know that granny is here for you when I'm not here, or dad is here for you when I'm not here. So you're just making that connection rather than trying to make it better. Is there anything else I wanted to? School being your eyes and ears when you're not there. So I think it's really helpful, isn't it, Debbie, to be
Mm.
able to get the reassurance. If the school are not coming to me and saying they're worried, then maybe I can rest assured once you
Yes.
have that good communication with the school. Because I know you spoke about when things are really challenging and really tricky, and we're seeing these behaviors, are saying that they're really struggling, and if they're not, or they're doing okay, sometimes we can kind of almost say, am I missing something?
Yeah.
So so we're always, we can never maybe feel the reassurance. So I
Yeah.
suppose
We always,
especially,
that's what we always go, God, they seem to be fine.
what am I missing?
Yeah, totally. We always question like they can't be fine, but like sometimes they are fine.
They are. And if the school is telling you they're fine, and if sleep is okay, appetite is okay, they're engaged in their usual activities, they're not having little aches and pains, because it can often manifest in little ones, the little icky tummy, the little maybe, some of the mimicking some of the symptoms that the patient is having.
Yes.
So it's like if all those things are okay and there's no concerns, then there's possibly no concerns. They're doing well.
Yeah.
And so, it's to give yourself that reassurance that you know them best. And if nobody is noticing any concerns, then they are doing. And they may have a moment next week. So it's like, everyone can have it at different times.
Yeah. Exactly. And it's actually nice as well, just you remind me of the invisible string for especially the younger ones, like up and even like, up until, 10, 11, 12, that you might have a transition object or something that they have and that you have, like you can use the stones or the hearts, or you can use a scent bags and put your perfume scent on it and they can smell you when you're not there. Or I know my little fella actually used to love sleeping with my dressing gown when he was small, because he would sleep beside it and he would feel like that was me in the bed beside him. So those little things can be really helpful if they are experiencing that bit of separation anxiety, which they will because they miss you. So any of those little tools can be great as well to
Yeah,
give them a sense of you be still being there.
absolutely. And like when you talk about the link object, I think like, even if you have a little more of time with them at some point and you can, even say you're out in the garden and you found a rock or a leaf, or you're at the beach and you found a pebble or a shell, that it's like that's that time where you can talk about that I miss you, and then I love you when I'm not there, and that can be the little link object then that they can remember that lovely moment that you had together.
And it's even like having a ritual way that you go off the phone.
Mm.
Like they love that. Like just one thing I use with my little fella at night time is like, you're safe and you're warm and you're loved. And that's the last thing I say every night. And he loves that because he'll say to me then, I'm safe and I'm loved. I'm like, you are. So even if you have, or I love that other one, I'll love you forever. I like you for always. As long as you're living, my baby, you'll be. And they just love that, just that rhythmic thing. And they're like, I know exactly how this phone call is going to end, and that will make me feel so safe and secure and loved. So it's lovely to do something like that when you're away, particularly.
Thanks, Debbie. I'm going to stop the recording now and see if anyone wants to put any questions.